Good morning, everyone. My name is Matt Braiman. I'm going to be giving you a presentation today on Batten disease, or CLN3. I'll explain what that means in a minute, but I'll be presenting on the etiology, symptoms, prognosis, and treatments. So what is Batten disease? Batten disease is an NCL disorder, which is a neuronal ceroid lipofuscinosis disorder. And that's one in which lipofuscin, a type of lipopigment, accumulates in the bodily tissues. It's a lysosomal storage disorder, and it's one of only 8 types of NCL disorders. And these are disorders that are genetically inherited and very neurodegenerative. So what this image shows is a confocal image stained with methylene blue dye. Blue and yellow structures here show the lipofuscin granules that accumulate systemically in Batten patients. And they are not normally phagocytized by lysosomes due to a dysfunctional protein which underlies the disease. So what are the symptoms and what are the prognoses of individuals who are afflicted with Batten disease? So there's a variety of hallmark symptoms in Batten disease. And I should mention that Batten disease tends to afflict children and young adolescents, but varies depending on the subtype. But the common hallmark symptoms include visual difficulties, which often start from the periphery. The child or the adolescent will lose their peripheral vision, followed closely by seizures and personality changes. And another sign that Batten disease might underlie the current patient's presentation are behavioral issues. So these children will sometimes act out in class, and teachers will notice this. And this will be another telltale sign that Batten disease might be the underlying disorder. Along with some variable symptoms, not every patient with Batten disease will express these, but dementia and psychosis and hallucinations can plague individuals with Batten disease. Echolalia, which is repetition of recently heard speech, as well as Parkinsonism-like movements. The progression of symptoms, the first signs they usually tend to be visual difficulties and seizures, but the personality and behavioral changes will usually come within a couple of years after that, although it's variable for each individual. And eventually late-stage symptoms will include motor decline and immobility, and also severe cognitive decline until eventually the child or adolescent needs full-time care due to immobility and on the inability to care for themselves. And unfortunately, the outcome is always death, and it's generally in late adolescence to the early 20s. So arguably one of the most difficult things about Batten disease is the difficulty in diagnosing the disorder. So it occurs in 1 out of every 100,000 births, so it is extremely rare. Children with Batten disease on average see 8 physicians and receive 2 to 3 misdiagnoses before finally receiving the correct diagnoses. And this is because symptoms can easily be mistaken for other diagnoses. For example, a lot of times young children will exhibit seizures for a variety of reasons, the most common being febrile seizures, which tend to just go away with age. And the difficulty with Batten is that will not go away with age, so getting the correct diagnosis can be very difficult. And there's no reason to see a physician until the obvious onset of symptoms, which, as I mentioned in previous slides, occurs around age 5 to 10, or even later for some subtypes of neuronal ceroid lipofuscinosis disorders. So the diagnosis generally occurs due to the combination of symptoms, seizures, visual difficulties, behavioral issues, as well as repeatedly seeing different physicians. And fortunately, sometimes families know that they're carriers of the disease since it is genetic. So what causes Batten disease? What are the neuronal and genetic mechanisms behind the disorder? So NCL disorders, or again, neuronal ceroid lipofuscinosis disorders, are caused by the mutated CLN gene, which as a whole encode for lysosomal proteins and enzymes. Batten disease specifically is caused by a mutation of this gene, which encodes for the protein battenin, which is a lysosomal transmembrane protein. And this usually results in a shortened, non-functional form of a protein, which is quickly broken down in 90% of cases, actually, or in a protein that localizes to the Golgi apparatus or the endoplasmic reticulum rather than to the lysosomes where it would in normal children and adolescents. So lysosomes, by which battenin helps form, are responsible for the digestion and phagocytosis of intracellular material, although the exact function of the protein battenin itself in this process is not known. So what are some diagnostic techniques that we can use to identify Batten disease as the underlying cause of the patient's presenting signs and symptoms? So the inheritance pattern for Batten disease is autosomal recessive. So if both parents are carriers, their children have a 1 in 4 chance of expressing the Batten phenotype. But if parents are unaware that they're carriers, electroretinograms can help detect retinopathy and the loss of ocular or retinal cells. Physicians can also use skin and tissue sampling, which can aid in the detection of lysosomal storage, material accumulations in the observed tissue. Some neuroimaging methods. So there's been a couple of magnetic resonance imaging studies tracking brain matter changes over time, and they found increases in cerebrospinal fluid in large ventricles, decreases in gray matter volume and overall brain volume in children and adolescents with Batten disease. And another an MRI study found on Batten disease patients hippocampal brain atrophy, but unfortunately, clinical findings were found in patients in mid to late adolescence well after the onset of symptoms, so using imaging techniques as a diagnostic measure may not be as helpful as I'm presenting it to be here. However, research in electroencephalography is now actually being performed here at the University of Rochester with hopes of identifying biomarkers of Batten disease for earlier diagnosis and intervention. What are the clinically effective treatments for Batten disease? There are none. There are no cures or treatments for Batten disease that are proven to be clinically effective at all. And unfortunately, care for these patients is palliative and supportive until the patient inevitably passes away. Fortunately, however, there is hope for Batten patients. So what's in the works? Symptomatic non-invasive interventions are being tested. So anticonvulsants like Depakote and lamotrigine, which are pharmaceuticals, can be used to ameliorate seizures, which is probably one of the most distressing symptoms for children with Batten disease. Occupational and physical therapy can be used to maintain motor function and independence. And anti-inflammatory drugs have now been used for patients who have visual difficulties, surprisingly. And melatonin can be used to assist in sleep disturbances. So these are all methods which treat the specific symptoms of Batten disease in order to improve quality of life. There are some more invasive methods that are being researched. Gene therapy has proven to be a more promising intervention. Recently, research in delivery of a vector called an adeno-associated virus, or AAV, to the central nervous system has been shown to ameliorate visual deterioration and behavioral abnormalities in mice. However, there are difficulties with gene therapy, which include the selection of the correct viral vector and delivery to the correct target tissue. Enzyme replacement is also a novel method, and it may be more effective in that it is directly delivered because crossing of the blood-brain barrier is facilitated with enzyme replacement techniques. Also, palmitoyl protein thioesterase, or PPT1, is the enzyme that is delivered to the central nervous system, and this aids in reduction of the accumulated lysosomal storage material in peripheral tissues. Stem cell therapy has been used in a small population of Batten children, resulting in mixed outcomes. There was a neurosurgeon that neurosurgeons will directly insert fetal neural stem cells into the brains of the affected children. So this is a very invasive measure. And one nonverbal child did show signs of speech return, but unfortunately it did not slow the progression of the disease in any fashion. And unfortunately all of the children again did pass away. But the targeting of transcription factors involved in modulation of the CLN gene may also be an efficacious intervention. So particularly the transcription factor TFEB is involved in the modulation of the CLN gene, and activation of this transcription factor has been shown to reduce accumulation of lysosomal storage material in the connective tissue of animal models, and this serves as a promising outlook for intervention in human patients. Unfortunately, there are a number of problems with these current options. Expenses for many of these treatments are unfathomable for so many families, especially after seeing so many physicians already and many already unsuccessful treatments. And additionally, the child just may not respond well to the treatment. Children with Batten disease are suffering, and many practitioners and researchers alike actually will argue that focus for these patients should be just to deliver the best quality of life possible, which doesn't necessarily include a variety of treatments, some of which are really invasive with varying success. Moreover, treatment is often unavailable for patients due to still being in the stages of clinical trials, the disease being so rare that few practitioners will feel comfortable administering any intervention, as well as difficulty traveling with the afflicted child. And different patients are going to exhibit different outcomes. Some treatments may be beneficial for certain patients, while for other patients, they may not benefit them at all. So hopefully the best approach would be a combinatorial one. I would like to believe that the best approach would be combinatorial, and this would include, early diagnostic measures, as well as treatment of symptoms by occurrence. So symptomatic-based treatments might provide for immediate relief from the most pressing symptoms, such as the pain, seizures, and the sleep disturbances. And more invasive interventions like enzyme replacement therapy and gene transcription targeting, pending approval in humans, may be implicated if the child responds well and if the family is in support of these methods. But above all, these children are suffering, and providing the best quality of life should be held to the utmost importance. And these are the references for this presentation. Thank you everyone for listening.